am VP of Patient Experience for Clearway Pain. So my role is really focused on patient access and intake and just overall contact center operations. For me, it's about really ensuring that our patient experience is seamless, from beginning to end, and of course, patient-centered. We are a multi-state healthcare organization that specializes in pain management. We have a couple different brands under the Clearway umbrella. So we also have Relieve Us, Eastern Neuro, and Center for Pain. So we have clinics up and down the East Coast. We have many clinics here in the DMV area, which is where I am. We also have clinics throughout Pennsylvania, New Jersey, Georgia, South Carolina, Alabama, Florida, and Texas. I think what sets Clearway apart, from our competitors would not just be, our ability to treat pain, because we do that very well, but also I think it's our commitment to improving the overall quality of life for our patients. And so we do that through accessible and coordinated care. Before implementing LeadSquared, our referral management process was very manual, extremely fragmented. We would have referrals coming in from all different channels, and our team would work out of a shared inbox in Outlook and then track it manually in a spreadsheet. So anyone that's ever had to work a process like that knows just how challenging that can be. It really slows down your operations. Ultimately, of course, that leads to, delays in scheduling, which then leads to delays in patient care, which goes against everything, my team is trying to achieve. So at that same time, our marketing team, they were looking for a platform to, kind of help drive their initiatives forward. So it was kind of like, why don't we team up together, and see if we can find a platform that can help both departments. The thing that initially really drew me, of course, was the integration with Athena. Because LeadSquared can actually implement with Athena. I think a lot of other platforms say that they can, and they can to a point. So they can get your scheduling template, they can book the appointment. But if you've ever, worked in patient scheduling, it's more than that, right? It's deeper than that. And Athena, you have to run the insurance, and that's what LeadSquared was able to do that many platforms can't. So at LeadSquared, because you guys can actually run the insurance and do everything we need to do, my team gets to work out of one system. So everything that they do in LeadSquared is automatically into Athena. So it really, again, cuts down on the time from our perspective. Besides the technology, I felt that your team was such good partners. Like, they really sat down with us and helped us mold out our workflow. And I'm like, this is what I need to see in my CRM. I want this logic and this automation build, and I want my template to look like this. And your team was able to do that with me. So it was definitely more of a partnership as opposed to just selling me a product. So our onboarding with LeadSquared went relatively smooth. We launched our Mid-Atlantic and Southeast regions end of January. And then our Relieve Us market, we just launched last month. Our team obviously loves it. It's very user-friendly. There's not a lot of questions on how to, navigate through the system. But anytime something comes up, so if we do have an issue, we're able to reach out, and your team is very responsive. They'll troubleshoot. Again, if anything does come up, there's never a major disruption, because the responsiveness from LeadSquared has been, just that good and that successful with us. Before, again, we were working out of Outlook and out of a manual spreadsheet. Or with Athena, when referrals come in, they will come in, say, via fax or an e-fax, but there's no way to communicate back to the referral source from there. And even in Outlook, everything was manual. But with LeadSquared, again, we've been able to build that logic and to create templates that will go out automatically so that we can constantly keep our referral sources updated on the process of their particular patient that they refer to us. I mean, our ultimate goal, of course, is to get patients the care that they need. And now we're able to reach more patients and we're able to engage with our patients in a much better and more efficient way, as well as then keeping our referral sources constantly updated, with the communication for their patients. So they appreciate that because they no longer have to reach out to us and say, were you able to get in touch with this patient or what happened with this? Because now it's all automatic through the system. So before this, we were only making contact with patients. We were doing 3 attempts where we would try to reach out to them. And there also wasn't a good way to measure how long it was taking us to even make that first initial attempt, or to accurately track, okay, I've made attempt 1, now I got to do attempt 2 for this patient, but I'm on attempt 3 for this one. But with LeadSquared, we're able to do that. So we've been able to increase our attempts from 3 to 5. And then also with that 5 attempts, we do the multi-channel approach. So we're not just doing phone calls, we're also sending out the text messages. And even just from that, the majority of our markets, we make contact with 100% of patients so that we get their referral within 24 business hours. And in our Relieve Us market, for our legal patients, we make contact within 1 hour. But I'm able to do that again because of the LeadSquared system. And then for conversion, prior to this, when we were using spreadsheets, we were only converting about 70% of our referrals. Now I'm between 78 to 82% every single month. I obviously definitely recommend any organization that's looking to utilize a CRM to look into LeadSquared, but to also look beyond just the technology piece. I mean, obviously being able to integrate with Athena is critical. But again, for me, it really goes back to that partnership. And when you have a team like LeadSquared that, is listening to you, is responsive, is able to adapt quickly, like that's top tier. So, and that has been my experience with LeadSquared. Before, again, LeadSquared, our referral management system was very manual, very fragmented. With LeadSquared, we're now able to have a seamless, patient-centered system that allows us to better serve not just our patients, but our providers, our referral sources, and our staff. It's kind of been like, if we can dream it, your team can build it.